Good morning, Chair Murray, Ranking Member Burr, members of the Senate Health Committee. I'm honored to join you today to provide an update on the COVID-19 pandemic. Since I last testified before this committee on July 20th, we have witnessed a steep increase in COVID-19 cases, hospitalizations, and deaths around the nation, largely fueled by the Delta variant. The Delta variant reminded us we need to be humble in our response to this virus and to follow the science as we modify guidance and address the pandemic. Here are a few things we've learned over the last 4 months. First, the Delta variant is notably more contagious and spreads faster than previous variants. Second, though breakthrough infections are infrequent, vaccinated individuals who are infected with Delta are able to transmit the virus. And third, while we have seen waning vaccine-induced immunity in certain populations, leading us to recommend the rollout of booster shots, COVID-19 vaccines are still highly effective and provide strong protection, particularly against severe disease, hospitalization, and death. While we are once again pleased to see downward trends in cases, this decline seems to be slowing, and deaths are not falling nearly as fast as we would like. On average, we still see over 1,000 deaths every day, and tragically, there have been more than 138,000 deaths since I last spoke here. As we look towards the coming weeks and months with some optimism, we must remember what the Delta variant did to this country, erasing weeks of prior progress and long downward trends, and reminding us that this novel coronavirus is unpredictable. In addition, we're entering the winter season, where we are predicting an increase in influenza and other respiratory viruses. We are concerned about this year's flu season has the potential to be severe. It's just as important as ever to get vaccinated for COVID and for influenza. We've made incredible strides in vaccinating the U.S. population against COVID-19. As of November 3rd, we have vaccinated about 85% of the United States population 65 years and older, 70% of those 18 years and older, 68% of those 12 years and older, and nearly 58% of the entire United States population. Some of our latest data only reinforce why vaccination is so very important, showing that unvaccinated people have 6 times greater risk of testing positive for COVID-19 and 11 times greater risk of dying from COVID-19 than people who are fully vaccinated. Importantly, we now have data showing that the Pfizer vaccine is nearly 91% effective in preventing COVID-19 infection in children ages 5 to 11 who did not have COVID-19 infection previously. Why is this such important news? Case surveillance data indicate that there have been 9,000 hospitalizations among children ages 5 to 11 since the beginning of the pandemic. Mortality data have recorded more than 97 deaths in this age group. There are now well over 5,000 children diagnosed with MIS-C and living with complications of this disease. As a mother, I know that no parent should have to see their child face long-term complications of an infection or be hospitalized. And we now have a highly effective tool to prevent this disease in our children. Following FDA's authorization, I endorsed CDC's Advisory Committee on Immunization Practices' recommendation that children ages 5 and up should receive a COVID-19 vaccine. I strongly encourage parents and their children to get vaccinated. And if you have any questions about the vaccine, please talk to your child's pediatrician, a school nurse, your local pharmacist, or a trusted medical professional. In addition to the critical work to get out of this pandemic through vaccination and other prevention strategies, we need to better prepare for future outbreaks and pandemics. One of the most important steps we can take to support these efforts is to support sustained, disease-agnostic funding for public health. This is how we will accomplish our goals to rebuild our public health workforce, invest in our public health laboratory infrastructure, ensure rapid response readiness, and improve our ability to collect and use data. I hope these bipartisan goals for members of this committee, and I look forward to continuing to work with you to achieve these investments. Before I close, I want to emphasize that the work we've done collectively to invest in and distribute vaccines has given us our most powerful tool to get out of this pandemic. Data show again and again that vaccines work, they are safe, and they can save your life. Thank you. I look forward to your questions.
Thank you. Dr. Fauci.